My name is Dr. Reza. I am the chair of bariatric surgery in Wesley Hospital in Brisbane, Australia. Specialty is a subspecialty of upper gastrointestinal surgery. I have been in this practice for 25 years. I am a dedicated bariatric surgeon. What motivates me is the best outcome in my practice for my patients, giving my patients the best experience in their journey that they've chosen towards the best weight loss. By the time they come and see me, they have gained a certain amount of information and knowledge, and then I will expose them to what they actually need to have done by involving a multidisciplinary team of myself, dietitians, psychologists, nurse practitioners, exercise physiologists, and everybody that can help them excelling through the journey that they have chosen. My practice is purely bariatric, so the majority of my primary cases are divided between sleeve gastrectomy and gastric bypasses that are one anastomosis gastric bypass and Roux-en-Y gastric bypasses. I use LigaSure XP for sleeve gastrectomies and gastric bypasses. The reason I like using it for sleeve gastrectomies is that the length of the jaw allows me to get way more than one short gastric at a time with very accurate hemostasis. For gastric bypasses, the full rotational and multi-rotational ability of this instrument allows me to work in different levels of lesser curve of the stomach, for instance, to achieve hemostasis of multiple small blood vessels in one plane, which reduces the time that I spent into dissection and creating the gastric pouches for my bypasses. They used a lot of ultrasonic devices in the past, and one of the biggest problems I had with ultrasonic devices is the lack of reliability on hemostasis, achieving full hemostasis in difficult cases. Once I changed to LigaSure and eventually LigaSure XP, I realized that I can rely on the very accurate hemostasis completely by using this device. I don't have to worry about point bleeders that I can't accurately control due to the heat of the instrument ends. So as a result of that, I use the instrument just about for all my surgeries at the moment. The multi-rotational feature of LigaSure XP allows me to, in one operating field, to turn around and work on different areas of hemostasis at the same time in multiple targets. And it also is longer and allows me to achieve deeper into the spaces where I need to get. And it also, the tip has slightly narrower, which allows me to use it as a dissecting device, dissect the tissue that I am trying to separate before hemostasis and coagulation. The other feature is that it can be used as a pair of scissors, because the cutting ability between the two jaws would allow you in completely avascular tissues. You can use it as a scissor, which hasn't been advertised a lot, but I've been using it in my own practice as a pair of scissors in areas that are completely avascular. The other thing I noticed with the LigaSure XP is that the time of the cycles, the duration of the cycles were actually shorter, which reduced the my altogether operating time, and the accuracy of the hemostasis and needing for twice activating was almost abolished, so I could just activate it in a shorter time with a better outcome. The other thing that I can see very regularly is that it doesn't stick to tissue like a lot of other energy sources do. You apply, get the outcome, and it just comes off the tissue very simply, and which is a very powerful new advantage over even its predecessors, the LigaSure Maryland. I can see that there is hardly any sticking to the tissues from this LigaSure XP. Putting all of this together with multi-rotational ability, it almost becomes an extension of my hands. When I'm operating, I just enjoy having it in my hand. It's almost like, I have a very accurate, reliable companion in my hand that is going to take me and my patients safely through this journey.